or today's session, I will be discussing how to improve consistency of information on carton container labeling and prescribing information. So as stated before, here's my disclaimer. The examples shown in this presentation may not contain all the recommended and required information on carton container labeling and the prescribing information. They're for presentation purposes only. So learning objectives, I will discuss when it's appropriate to have an inconsistency between information on the carton and container labeling and the prescribing information. I will also discuss when it's potentially inappropriate to have inconsistency between the carton container labeling and the prescribing information. Additionally, I'll discuss appropriate dosage recommendations on the carton container labeling, as well as appropriate dosage terminology, the appropriate dosage terminology statement on the carton container labeling. Finally, I will discuss a consideration about using terminology such as the prescribing information instead of package insert on carton and container labeling. So first of all, there are key differences between carton container labeling and the prescribing information. And this leads to appropriate inconsistencies between carton container labeling and the prescribing information. So there are many audiences of the prescribing information, carton container labeling, but for the main audience for the prescribing information is the healthcare practitioner. For carton container labeling, it could be potentially broader. It could be healthcare practitioners, or it could be patients, it could be both, it could be caregivers. With respect to the information, as we know, the prescribing information contains a summary of the scientific information needed to use the drug safely and effectively. The carton container labeling, as described by Alice before, has a slightly different purpose. It's basically about safety, potentially reducing medication errors. And as Alice explained, this is throughout the entire medication use process, potentially first from procurement, stocking, in terms of dispensing, preparing, and also administering. Additionally, as Alice described when she showed that picture of a typical pharmacy shelf, carton container labeling is very important for appropriate selection, identification of your appropriate product on a very busy pharmacy shelf. So that leads to the differences lead to appropriate inconsistencies between carton container labeling and the prescribing information. Finally, the format of the products or the documents are different. Well, the prescribing information, I have found prescribing information as short as 5 pages, 8.5 by 11 page document to up to 83 pages. There may be some prescribing information a little less. I'm not sure if there are any prescribing information more than that. But that's the general sense of how the length of the prescribing information. With respect to carton container labeling, you may have small labels, carton labels, you may have larger ones, similar with cartons, large and smaller carton labeling. So there are some acceptable differences between carton container labeling, and prescribing information. So as you know, the prescribing information contains detailed information about the indication, the recommended dosage, important administration instructions, contraindications, warnings, precautions, drug interactions, specific populations. You heard about pregnancy, lactation, females of reproductive potential, pediatric use, geriatric use, etc. All that information is not on carton container labeling. Carton container labeling, as Alice discussed earlier, can include some warning statements or cautionary statements. Typically, if they're present, there may be a sentence long. So those are some of the differences. Carton container labeling may have additional content that's lacking in the prescribing information. For example, or additional statements For example, carton container labeling in general requires the terminology RX. However, this is not recommended for the prescribing information because the prescribing information is for the healthcare practitioner. It is for only human prescription drug and biological products. So the RX is not needed. Similarly, when carton container labeling may contain statements such as keep out of the reach of children, which may be appropriate if the end user is a patient or a caregiver. However, that would not seem to be appropriate for the prescribing information, because the intended audience is the healthcare practitioner who is not potentially not using the product with children around, or using the prescribing information with children around. Additionally, there are, as Alice stated, there are different requirements in terms of barcodes and expiration dates that appear on carton container labeling that do not appear on the prescribing information. Finally, as discussed previously by Debbie, there are differences in format between the prescribing information of certain elements and the carton container labeling. And she talked about the differences between elements such as format between the proprietary name, the non-proprietary name, dosage form, particularly in the product title, versus the carton container labeling. So now I'm going to switch to potentially inappropriate inconsistencies between the carton container labeling and the prescribing information. So as mentioned in several guidances, with these inappropriate and inconsistent, with several elements, we should have consistent content on the prescribing information and carton container labeling. So with respect to the product title guidance talks about consistent content with respect to the proprietary name, non-proprietary name, dosage form if it's not included in the non-proprietary name, route of administration, controlled substance symbol. Jabril earlier talked about the USP SALT policy, and he talked about including an equivalency statement on carton container labeling, and he also talked about an appropriate equivalency statement in the description section of the prescribing information. So that information should be consistent. Similarly, Alice recommended the 2013 guidance about safety considerations to reduce medication errors for carton container labeling. And also, I should bring up the PLR implementation guidance, and both those guidances discuss consistencies of the unit of measure on carton container labeling and the prescribing information. I should say the latter guidance brings up some in terms of consistency. The formal guidance talks a lot about unit of measure. So with that in mind, this slide just presents some, but not all, of the elements on carton container labeling. And for the purposes of this presentation, I'm dividing the information into two categories. Product quality focused content and clinically focused content. Now this classification is not perfect because some of the items, for example, in the product quality focused content column may have clinical related elements. So this is really more for the purposes of this presentation here. But we have seen when we've looked at carton container labeling and the prescribing information, all these elements, both product quality focused and clinically focused, we've seen differences, and I would say inappropriate differences. And one thing to keep in mind, I think one of the reasons why I classified it as product quality focused and clinically focused is potentially clinicians may or may not be reviewing the carton container labeling, contrasting the content in there and the prescribing information. So one of the take-home points is have your clinicians, pharmacists, other healthcare providers, nurse practitioners, physicians, look at the carton container labeling to ensure content, that the clinically focused content is consistent. So now let's first turn to quality-related items, the consistency between the carton container labeling and the prescribing information. So in all these examples, I'm going to put up an example of carton labeling and also an example of one aspect or one part of the prescribing information. So here, and green is going to represent the item being correct or preferred, and red is going to be the item that is incorrect or not preferred. So in this situation, we're talking about the dosage form terminology. This is a product that is supplied as a lyophilized powder, and it's reconstituted, must be reconstituted to form the final dosage form that's going to be administered. So it comes as a powder, and it's administered as a liquid. And Jabril talked about that term 4. That 4 is a critical element. So the appropriate dosage form terminology, according to USP nomenclature guidelines, as Jabril mentioned in his talk, is 4 injection. Now you're taking a look at the beginning part of the highlights of prescribing information, just a little part. Here you have the highlights of prescribing information heading, then the highlights limitation statement, the product title, and the initial use approval. And I highlighted in red the dosage form, and it says injection. That is not correct. That's not the correct dosage form. So here you have an inconsistency between the carton labeling and the prescribing information. Similarly, so to correct this, the correct dosage form for this lyophilized powder is to use 4 injection on the carton labeling and use the term 4 injection in the product title. Additionally, as Debbie Beitzel talked earlier, the terminology in the product title, the dosage form terminology, should be consistent throughout the entire prescribing information. So not only should it be 4 injection in the product title, it should also be 4 injection in the dosage forms and strengths heading and highlights, and also sections 3, 11, and 16. Dosage forms and strengths, description, and how supplied, storage, and handling sections of the prescribing information. Additionally, the dosage form is mentioned in several other parts of the prescribing information. For example, it's typically mentioned after reconstitution in section 2, dosage administration. We should use that terminology consistently. Okay, great. So now we're going to another example of strength expression. In this example, there's an inconsistency between what appears on the carton container labeling and the prescribing information, and this is inappropriate. So right here is a picture of a carton labeling, and it's got one expression of strength. As discussed by Jabril and Alice, if you have single dose or multiple dose injectable products, the recommendations are to have double expressions of strength. And this is primarily, my understanding at least, is previously if you've had a single expression of strength and maybe, so the double expression of strength, I'll show you the correct thing. I'm taking the green is from the full prescribing information. I'm looking specifically only at section 3, dosage forms and strengths, and the double expression of strength is 10 milligrams /2 milligrams, which is the total amount per total volume, followed in close proximity to the amount per milliliter. And previously, one of the concerns when there is not a double expression of strength, if it's only labeled 5 milligrams per milliliter, there was medication errors. So potentially someone would give an entire amount of the product that would be double the dose. So given that reason, the recommendations is a double expression of strength. So on the left, the carton container labeling is incorrect. It's got a single expression of strength. So again, the expression of strength should be consistent in the carton labeling and the full prescribing information. So let's say you do a PLR conversion for a product and the old format labeling only has a single expression of strength and the carton labeling only has a single expression of strength. In addition to modifying the prescribing information, you have to think about modifying the carton and container labeling, that it should be correct, and also it should be consistent. And recognize sometimes I'm taking an example where carton labeling is incorrect, and sometimes I'm saying prescribing information is correct. We've seen both situations. One is correct, and the other one is incorrect. Okay, so now we're going to package type terms. So there are 5 package type terms for injectable products, basically single dose, multiple dose, single patient use, pharmacy bulk package, as well as imaging bulk package. The guidance that I described below describes 3 of those. Again, these are for injectable products. In multiple dose, I should say in multiple dose or multiple dose, single dose, and single patient use containers. The guidance talks about 3 of the 5 package terms. So the appropriate package term here is single dose for this parental product. So here under section 3, if the package term is included, when the package term is included, that's correct. But now going to the carton labeling, this uses the term single use, which is incorrect. Now let's go. We talked a lot about product quality or product quality focused information on both carton container labeling and the prescribing information. Now we're going to shift to clinically focused information in the prescribing information and carton container labeling. So here is dosage, recommended dosage. So looking at the left, it actually states the usual dosage, take 1 tablet orally once a day. So the recommendation is to take 10 milligrams once a day. However, if you look at the prescribing information, and now we're going to section 2, dosage administration. The recommended dosage of drug X is either a lower dose, it's 10 milligrams once a day for the lower weight patients, but it's 20 milligrams once a day for the higher weight patients. However, if you just look at the carton labeling and use 10 milligrams once a day, you would be underdosing the higher weight patient, and that potentially would have less efficacy. The patient, maybe the drug wouldn't work, and that to me is one of the biggest issues. Actually, to me, of all the issues I've seen of inconsistency, this is the biggest issue about dosage. Basically, if you were when you look at your update your prescribing information, make sure your carton container labeling is also up to date. And this can clearly lead to medication errors and potentially consequences. I just mentioned an example where potentially you're underdosing, you may have lack of effectiveness. You could also have the reverse situation, you may be overdosing, and there would be maybe a safety concern, an unnecessary safety concern. Okay, so with respect to dosage, as you know, the dosage and administration section can be very complicated. A recommended dosage could be what's the recommended starting dosage, what's the recommended titration, what's the maximum dosage, how do you adjust the dosage due to drug interactions, how do you adjust the dosage due to adverse reactions. You have dosage recommendations in specific populations, mild renal impairment, moderate renal impairment, severe renal impairment. You also have different recommendations in terms of duration. There are maybe some recommendations about what medications to take prior to using the product. So maybe you want to use some antihistamines and some steroids before you use a product that is associated with hypersensitivity reactions, for example. There's also recommendations about concomitant medicines. Some concomitant medicines are required. Anne-Marie Trentacosti talked about that previously in her Labeling transformation examples, you talked about prednisone was part of the conditions of use, part of the indication. It must be used to achieve efficacy. So this type of information would be included in the dosage administration section of labeling. So imagine trying to include all of this information on a very small container label. Imagine trying to include this information even on a large carton labeling. Probably very hard. So in these situations where you can't include all the dosage, it's perfectly acceptable, according to our regulations, is to refer to the prescribing information for the entire dosage. Not try to capture it all on your small container labeling. So, as stated earlier, the carton container labeling must include a statement of the recommended or usual dosage. There are some exceptions here, and I listed them below, of this requirement. And if the dosage regimen is only 10 milligrams once a day, and there's no dosage adjustments due to adverse reactions or drug interactions, there's no dosage recommendations in specific populations. It's very simple. You can clearly include that on your carton container labeling if there's enough space. That's the way to go. However, if it's complicated and there's space limitations, just refer to the prescribing information, and that's all. Don't provide any dosage. Okay, so dosage terminology, inconsistent between prescribing information and carton container labeling. So I'm showing a picture of the carton labeling, and it uses the term usual dosage. In general, consider, in my view, that would be potentially a suboptimal terminology with PLR labeling. Looking at the full prescribing information, again, this is the dosage administration section. This is a recommended dosage. The term recommended dosage may be different than the term usual dosage. And I'll discuss that later in the presentation. Actually, right now in the presentation. So in 1979, we talked about yesterday, was old format rule with associated regulations. 2006 was physician labeling rule with associated regulations. So in 1979, the terminology in the dosage administration section is the recommended usual dosage. However, in PLR, that was changed to the recommended dosage. So if you go into the regulations for the Section 2 dosage administration section, it states recommended dosage. And as stated earlier, the recommended dosage may be different than the usual dosage. The usual dosage may be, if you look at a population, may be on the higher end of the dosage range, but it may not capture the recommended dosage. The usual dosage may be off-label. Maybe it's higher than what's the recommended dosage. So consider using the term, so consider for PLR labeling, again, PLR regulations has recommended dosage. Consider using terminology dosage, see prescribing information, or using the terminology recommended dosage, see prescribing information. Again, this is if you can't fit the entire dosage recommendations on a small carton labeling or a small container label. So, what do we do potentially for non-PLR format labeling, old format labeling? So again, the regulations state usual dosage. So you could say usual dosage, see prescribing information, or you could say dosage, see prescribing information. I mean, one way to think about it easier, not to worry about whether it's in PLR format or old format, you could just say dosage, see prescribing information. So in this way, again, you don't have to worry about whether it's PLR or old format. It also saves you space. So the last thing is a consideration about terminology, consider using the term prescribing information rather than package insert on the carton and container labeling. So here on the left is package insert, and here on the right in the green is prescribing information. And so, as stated earlier, the carton container labeling regulations gives you an option. So again, if there's limited space, you could use a dosage terminology statement to refer to the prescribing information. The regulations state that this requirement would be met. Again, you can't include all the dosage on the carton container labeling. You could refer to the prescribing information. You could meet this requirement by stating that see package insert for dosage information. So that's in the regulations. However, this is an option. This is one example. Other examples may be used. So understanding that's optional in terms of that exact statement, consider this. So why would you consider using the term prescribing information versus package insert? Well, we know, first of all, when PLR was created, PLR came out, Physician Labeling Rule, came out in 2006. It was in development in the 1990s. At that time, look at that time compared to now. Electronic use, visualization of labeling has increased tremendously. With our computers, with our handheld devices, our tablets, with our phones. People are accessing prescribing information that way. So using the terminology package insert doesn't seem to be consistent with potentially if you're using if you're accessing the prescribing information electronically. Additionally, sometimes, as discussed earlier, the drug may have an instructions for use. It may have a medication guide or a patient package insert. So referring to the prescribing information as the insert or package insert seems not to capture all the paper within a carton. The carton can contain the prescribing information, the instructions for use. It can contain medication guide or patient package insert or other information. Although our older regulations and rules can use the term package insert, all of our newer statutes, our regulations and rules use the term prescribing information. For example, the Cures Act, as I discussed earlier, it's got new requirements for LPAD, limited population, susceptibility criteria. We use the term prescribing information. PLLR is a relatively new rule, came out in 2014. We use the term prescribing information. You look at all of our guidance, we use the term prescribing information, not package inserts. Finally, with respect to the titles, we have 3 sections of the prescribing information, including the highlights of prescribing information, full prescribing information contents, full prescribing information. It's not, the term is not highlights of package insert, full package insert contents, full package insert. That's not the terminology one uses. It's not the terminology in the regulations. So, essentially, here are the guidances, that resources. These guidance, specific carton container labeling guidances are included on the CDER Prescription Drug Labeling Resources webpage, and I have a link below. Product quality related specific guidances are included on the Prescription Drug Labeling Resources webpage. As I stated earlier, one of the big changes that we did, this webpage formerly was known as the PLR requirements for prescribing information. It was mostly PLR resources. We've expanded that to product quality and also carton container labeling. And also, you heard the earlier talk, patient labeling, biological product labeling, and labeling, lots of information. So question 1, what content can differ between the prescribing information and carton container labeling? Anyone want to shout out the answer? E? That's correct. E. I mean, the format of some of these items can differ, but the content um, should be the same. So summary, so when you're developing carton container labeling and prescribing information, ensure information is consistent if applicable. As I mentioned earlier, there are some things that are appropriately inconsistent. Consider having clinicians review the carton container labeling for clinically focused content. When you update the prescribing information, let's say of a labeling supplement, you're adding an adverse reaction, or you're adding, let's say you're adding you have new information about how to identify the product. Previously, the product looked basically clear, and now it's acceptable, you think, but it's white to slightly yellow. Well, if that occurs, if the identifying characteristics are on the carton container labeling, update that too. So think of the labeling together when you develop the labeling. Consider using appropriate dosage statement terminology and dosage recommendations on carton container labeling. If you can't put it all on the carton container labeling, basically just refer to the prescribing information, such as dosage, see prescribing information. That will work for both PLR format and old format. And finally, this is just a consideration. Consider using the terminology prescribing information rather than a package insert on carton container labeling. And finally, if you guys have questions with respect to this presentation or other presentations, you're welcome to use that web address. And what I'll do is I'll forward it to the relevant parties. And these are general questions about the prescribing information, carton container labeling, FDA-approved patient labeling. They're not product-specific questions.